What are the dangers of drug abuse during pregnancy? IUGR, fetal hypoxia, respiratory distress syndrome, maternal malnutrition, infection, preeclampsia, dysfunctional labor, and hemorrhage. What is the best way to test for bacterial vaginosis without a microscope? The whiff test, done by touching a cotton swab with discharge in a bit of KOH solution. If it lets off a fishy odor, then it's BV. What are the risks of chorionic villus sampling? Miscarriage and infection because the sample of placenta tissue must be obtained through the cervix. Also, a significant number of false positives and negative findings, and the procedure may actually cause fetal anomalies. What complications or conditions can prior use of IUD cause during pregnancy? Anemia due to excessive menstruation, scarring of the uterine lining, which predisposes ectopic pregnancy, irregular implantation of the placenta, and third-stage hemorrhage. What is considered normal blood pressure during pregnancy? Normal blood pressure during pregnancy is 90/50 to 100/90. Higher readings than 130/80, or a steady rise from the baseline, are cause for concern. What are the dangers of severe asthma in pregnancy? Respiratory infections and stress may intensify attacks. Cardiopulmonary function can be reduced, which affects fetal growth and well-being. Also, certain medications used to treat asthma are contraindicated during pregnancy. While performing step 4 of pelvimetry, what would you expect the width of the pubic arch to be? You should expect to be able to fit 2 fingers beneath the arch and spread them slightly apart. What is the usual course of treatment for gonorrhea? A course of ceftriaxone, CEFTRIAXONE, ceftriaxone. Axone? Yeah. What are the risks of gonorrhea in pregnancy? Chorioamniocentesis, premature rupture of the membranes, premature labor, and blinding eye infections for the baby. What is a natural treatment you would recommend to your patient who has trichomoniasis? The normal treatment for trichomoniasis is Flagyl, which is contraindicated in pregnancy. Alternatively, an herbal douche is often effective when combined with garlic suppositories. What herbs are contraindicated during pregnancy? golden seal, Afida, cotton root bark, blue cohosh, pennyroyal, and birthroot. When performing pelvic assessment, what is the first thing that you should be checking? The cervix. Note its condition, position, any growths from the OS, such as cysts or polyps. At what point in gestation might it be necessary to confirm gestational age through bimanual exam? When baby is less than 16 weeks, you may confirm estimated due date with a bimanual exam to determine the size of the uterus. At 10 weeks, the uterus is the size of a large orange or softball. 12 weeks, the size of grapefruit. 14 weeks, the size of a cantaloupe. And 16 weeks, the bimanual exam is no longer necessary, as the fundus may be palpated midway between the pubic bone and umbilicus. When advising parents of Northern European descent on genetic screening, which disease would you tell them their baby is at increased risk for? Cystic fibrosis, which is characterized by lung disease and limited lifespan.